In a country of 82 million, Turkey has already rolled out 75 million doses of COVID-19 vaccines. Out of that number, 28 million people are fully vaccinated, putting the country's goal of reaching a 70% immunity level within reach. But there have been some stragglers, people unsure about the side effects of getting the vaccine. Turkey so far hasn't seen that hesitancy break out into protests. But across Europe and in parts of North America, people unwilling to get vaccinated are pushing back against the restrictions being placed on them. Ludovica Brignola has this report.
As governments try to get coronavirus infection rates under control, citizens continue to protest their efforts. In London, protesters attempted to storm a former BBC television centre. They were describing media as the virus and criticising the state broadcaster's coverage of the pandemic. In Paris, police deployed tear gas last week as thousands protested plans to issue vaccine health passes.
Stop this discrimination, stop this apartheid, stop Macron's tyranny. We need to stop the COVID madness.
France is among a growing number of nations imposing rules aimed at encouraging vaccination as the Delta variant drives increasing infection rates. The latest government-mandated health pass means that vaccination, a negative test or proof of recent recovery, is required to enter public spaces like restaurants and cinemas. All healthcare workers in France are also required to be vaccinated by mid-September. In Germany, hundreds were detained at protests, many of which had been banned by authorities, including one organized by the Stuttgart-based Querdenker movement. The movement is the largest and most visible anti-lockdown group in Germany, bringing together coronavirus deniers, conspiracy theorists, and right-wing extremists. There have been no major protests in Turkey, and the government hasn't planned to issue health passes yet. But like the rest of the world, the country is facing vaccination hesitancy. A spike in daily infections, especially in the country's east, has been driven mainly by a slowdown in vaccination numbers. According to data, the vaccination rate is at its highest in southwestern Muğla province, while southeastern Şanlıurfa ranks last. Central provinces such as Konya also lag behind. More than half of Turkish citizens over 18 years of age are now fully vaccinated, but recent surveys indicate that about 15% of respondents remain unsure about vaccine safety. The country ranks 8th in the world for doses of vaccines given and 10th for number of people fully vaccinated. But the path to a 70% mass immunity is still long. In order to make the need for vaccination more compelling, the government and businesses have started to introduce restrictions on the unvaccinated. Health Minister Fahrettin Koca has said that they might ask for regular PCR tests from people without 2 doses of vaccine every week. Turkish media company Saran Holding has announced it will lay off employees who are not vaccinated. And the Turkish Football Association announced this week that adult spectators will be required to show proof of full vaccination to enter stadiums. Ludovica Brignola, Straight Talk.
And to discuss what's fueling this hesitancy, joining me now from Montreal is Alexandra Sicotte Levesque. She is the team lead of community engagement at the International Federation of Red Cross and Red Crescent Societies. And from Ankara, Serhat Unal. He is a professor at Hacettepe University's medicine faculty. A warm welcome to you both. So, Serhat, doctors and scientists are saying that vaccines are safe. Why there are so many people still unwilling to get vaccinated since they're available and doctors say that they actually work? What's behind this vaccine hesitancy?
Well, there are 2 groups of people actually in that perspective. One, the people who are really against vaccine for long years, including all the other vaccines that was available before. And that is very hard to deal with them because there's no scientific background for them. They just believe that vaccines, not only corona, but all vaccines, are not valuable. And the other group, the most majority actually, the hesitancy about vaccination, they are a little bit afraid of the vaccines are developed so fast. So that group is being convinced day by day, and the increasing A number of people are getting vaccinated. Today, we know that, yes, they are developed very fast, but according to the scientific rules, and we know that vaccines are safe and effective, and we got to prove those people who has hesitancy about the vaccine because they were developed very fast.
Yes.
And I would just leave the other group alone, but work on this group.
So, Alexandra, if I'm mistaken, you're one of those people who are trying to convince these hesitant people. How do you work? What should be done? How do you build trust? And how important it is working with the community? And have you been able to receive any positive results yet?
Thanks so much. Yeah, I mean, there's not one way, obviously, to increase vaccine acceptance. It's a very complex thing. But I think today the most important thing is to listen to people and people's concerns and fears and to address them, and also to adapt the way we work and our response towards that. Obviously, the pandemic has been a crisis of mistrust. And the causes are complex. It didn't happen overnight. I think there were a lot of conditions for that before the pandemic. And there's been a lot of conflicting information and confusing information throughout the pandemic. So all these things has fueled mistrust. So for us at the Red Cross, our volunteers are there around the globe to listen to people's concern, answer concerns, and ensure there's dialogue. And that, I think, at this point in the pandemic is one of the most important thing to do, and to ensure that we have the trust of communities and to ensure that we're transparent and that we have, as much as possible, consistent information to share.
Yeah.
But one thing we've seen, though, over the past year is that there's been an increase overall of vaccine acceptance. I mean, the data we've been looking at recently shows that about 75% of people globally would accept a vaccine if it was available to them. And to us, that shows that if vaccines were available for everyone, then we would be seeing something different today.
Okay. So, Serhat, how has the Delta variant increased infections worldwide? And how does this vaccine hesitancy make ending this pandemic much more difficult?
Well, as you know, as the virus is cultivating more and multiplying more, it may cause the new variants. And the British variant came out, and it's 2 times more transmissible compared to the original one. And among them, the new variant Delta has came out, and it's 2 times more transmissible to the people comparing to the British variant. So we have to stop these variants. To be able to stop that, we have to stop the transmission. Mask, distance, and the hand hygiene is the major thing. And the other one is the vaccine. We have to vaccinate people and avoid the possibility of multiplying in the body of the people. So if we vaccinate well and follow the rules, we may stop multiplication of the virus and stop the new variants. Delta is not influenced by mostly by the available vaccines. So this is the time that we have to do the most number of vaccine and apply the rules that we can stop it before we get any new variants. So it's very important.
Yes. So vaccine mandates are not new at all. We have seen polio, smallpox vaccination drives in the past, and a lot of people who are hesitant today are actually getting vaccinated. They're coming from that era. So, Alexandra, what explains this change? Why are generations that are used to vaccines are now skeptical?
I think, I mean, obviously, as I said earlier, it's a new pandemic, right? It's a new disease. It's a new vaccine. So as we heard earlier, there's a lot of new to this. And so there's a big proportion of people who are vaccine hesitant, who have a lot of concerns. And those are the people I think we need to focus on and think about because they may accept a vaccine. And we've seen this over the past couple of months as vaccines are more and more deployed in different countries. People are seeing the results of vaccines. There is an increase in vaccine acceptance in many countries and globally. So I think this is why we're seeing this hesitancy, because it's a new disease and it's a new vaccine, and there's been a lot of different information shared over the past year, and so people are confused. A lot of people are confused.
So, Serhat, a number of countries across Europe and parts of North America we have seen mass protests against these vaccination passes. Where do you think Turkey stands when compared to these countries, and is Turkey likely to introduce health passes for the upcoming period?
The pass is still being worked on that, and I know that Ministry of Health has done an agreement with the European countries, and we developed the pass, and it will be accepted soon. It not only the vaccination status, but it will talk about the whether you have committed the disease and you became immune as well. And in the perspective of the protest against this vaccination in Turkey, I don't think so that we will have this kind of protest. Our problem, especially in the Eastern Anatolia, there are group of people who are living all together and they have a leader, local leader. If the local leader says no, if you will not be vaccinated, they totally obey that.
Yes.
So the new program is focusing on that to convince those leader position people to have more people vaccinated.
So, Alexandra, there are strict laws in place to protect public health already. Could this someday be translated to people who continue to refuse to get vaccinated?
I don't think so. I mean, you talked about the passport and the vaccine passport. Obviously, this is not new. It's something we've seen in a lot of different countries, and we've seen before this pandemic, and we see that it does increase vaccine acceptance. But I think the main issue currently, and this is something we need to emphasize for us at the Red Cross, Red Crescent, is that only 1% of people in low-income countries have received a dose of the vaccine. And as long as the vaccine is not widely accessible to different people, this is going to be the main issue that we need to address.
But Serhat, do you believe there should be some consequences for anti-vaxxers when they get COVID? And what kind of a danger do they pose to the public, in your opinion?
Well, obviously, if the people does not accept the vaccination, they accept that they may get sick personally. It's up to them. But on the other side, as I've explained before, the virus will continue to multiply and will cause the selection of the new variants that will be more problematic to the world, to the all mankind. So it is a community responsibility, our responsibility against community to have the vaccination and to stop this epidemic. But especially in Turkey, in the last years, there were changes in some laws. We cannot make the people have the vaccination as an obligation. But this is a pandemic situation, so the Ministry of Health will not make it obligatory to have the vaccine, but some other institutions like the Federation of the Football has explained that they will not let the spectators go into the stadium if they don't get the vaccination. Otherwise, they have to go the PCR test. So I think it will go like that. It's not an obligation, but will be some mandates by some special institutions. And I believe that it is the responsibility to the community of each person to protect himself by vaccination to be able to stop this global pandemic.
All right, Serhat, Alexandra, unfortunately, we'll have to leave it here. Thank you very much for joining us on Straight Talk.